So, welcome everyone to our class today. What is healthcare and how is health defined in Canada? Some of our objectives that we'll be looking at today is about healthcare in Canada and how it plays a part in our everyday living and how we as patient advocates can navigate through our healthcare system. So, today in our lesson, we'll be looking at what healthcare is, the Canadian healthcare system, the types of healthcare services that we have in our Canadian healthcare system, the evolution of how the Canadian healthcare system came to be. We'll look briefly at the Canada Health Act. We'll look at the federal role that the federal government plays in our Canadian healthcare system. We'll look at the provincial role and how the provinces play an integral role in developing the healthcare that we have come to know and understand as our Canadian healthcare system. We'll look at how much government spends on healthcare in our country, and we'll also look at the future of our Canadian healthcare system. At the end of our lesson today, we will have an opportunity to discuss and have a question and answer period where we can certainly discuss and debate the issue of healthcare in Canada. So what is healthcare? Well, efforts made to maintain or restore physical, mental, or emotional well-being by patients within our healthcare spectrum. And this is done especially by trained and licensed professionals, our doctors, our nurses, healthcare professionals or practitioners that are licensed individuals to deliver and develop healthcare within our healthcare system. When we look at our Canadian healthcare system more specifically, well, Canada's healthcare is publicly funded and is delivered privately. The British North America Act of 1867 gave our provincial bodies the autonomy to develop and to administer our healthcare within Canada. Since 1867, our healthcare system has evolved tremendously to our present day system and certainly has gone through a metamorphical change over time. It's best described as an interlocking set of 10 provincial and 3 territorial health insurance plans. Better known to Canadians as Medicare, the system provides access to universal comprehensive coverage for medically necessary hospitals and physician services. These services are administered and delivered by the provincial and territorial, and that could be equivocal to state or regional governments, and that treatment is provided free of charge. When we look at types of health services, well, we have primary care, secondary care, and additional care. Our primary care services really focuses on prevention and treatment of common diseases and injuries. It also encompasses basic emergency services and referrals to and are coordinated through various levels of care, such as hospital and specialist care, primary mental health care, palliative and end-of-life care, health promotion, healthy child development, primary maternity care, and rehabilitation services. Secondary care is usually delivered in the home or through a community setting, or via institutions such as long-term facilities or chronic care facilities. And additional care that is encompassed in our healthcare services are prescription drugs that are delivered outside of the hospital, dental care, vision care, medical equipment, and appliances such as prosthetics, wheelchairs, or aids to daily living. And other types of services that other health professionals deliver, such as physiotherapists, chiropractic treatment, and other types of professional services or additional health services, such as massage therapy and other types of services delivered by paramedical practitioners. So when we look at the evolution of Canadian healthcare services, well, again, I previously mentioned back in 1867, the British North American Act gave the provinces the responsibility for establishing, maintaining, and managing hospitals, asylums, and charities and charitable institutions. And the federal government was given jurisdiction over our marine hospitals and quarantine type facilities. So our healthcare system goes back all the way to 1867, when Canada first was made a dominion within the Commonwealth of the United Kingdom. Over the years, our healthcare system has evolved tremendously. And in 1957, the federal government passed the Hospital Insurance and Diagnostic Services Act. Fast forward to 1977, and over that 25 plus years, our healthcare system really evolved into becoming what we have as a present day system. And to say that it is continually evolving is absolutely 100% correct. As we have a change in our dichotomy of peoples within our country, we have a change in services, and we have an evolvement of the types of services that our Canadian people need and require in their healthcare. In 1977, the Federal Provincial Fiscal Arrangements and Established Programs Financing Act came into fruition. This was the first sense of the shared responsibility of healthcare costs being shared between the federal government and the provincial governments. When we look at 1947, this was where the government of Saskatchewan introduced the province-wide Universal Hospital Care Plan. And a similar plan was also adopted by British Columbia and Alberta in 1950. And this was really the first, I want to say, vision of a universal healthcare plan. And that was, if we look back and see who the players were, that was established by Tommy Douglas. And he is the modern man or the modern person who we look to and say he was the founder of universal healthcare. Transitioning into 1966, the federal government passed the Medical Care Act. And so we can see that these dates are interdispersed along our continuum to bringing us to a present day situation of the deliverance of healthcare in Canada. And in 1984, the federal legislation of the Canada Health Act was passed. So as you can see on our slide here, we have a wide range of time periods that our healthcare has evolved in from 1867 all the way to 1984. And we're in a transition period currently where our healthcare systems are evolving, not only fiscally and the responsibility is shifting, but who is really truly responsible for what areas of our peoples, what areas of healthcare are the responsibility of different sections of our government, and who will ultimately be the final say in who governs healthcare in Canada. So Tommy Douglas is the, I want to say, the man who we look to and can look at as the founder of healthcare in Canada. We're going to take a moment now and watch this video about Tommy Douglas and how he brought the ideology of healthcare to Canadians.
Hi, my name is David Morrison, and I'd like to welcome you to Making Medicare, the history of healthcare in Canada from 1914 to 2007, an online exhibition produced by the Canadian Museum of Civilization. Covering more than 90 years of Medicare history, this new online exhibition offers a thorough, reliable, and engaging account of the birth and development of Canada's publicly funded healthcare system. The story is told both chronologically and by subject area. Canada's Medicare story begins during the First World War, when a special federal healthcare program was created to care for ill or wounded veterans, a large group of citizens then in crisis. The 1930s depression hit Western Canada very hard. At particular risk were rural hospitals and the doctor supply, each of which soon needed provincial government's financial protection through new systems of hospital insurance for all residents. I am standing in the face-to-face Canadian Personalities Hall exhibition in the Museum of Civilization. More specifically, I'm in the Tommy Douglas module. As Premier of Saskatchewan, Douglas led his party in the early 60s through minefields of opposition to enact Canada's first healthcare program. In 1964, a Royal Commission report on universal healthcare revealed how and when it could be implemented. With provinces complying, Parliament passed the Medical Care Act of 1966, although weaknesses in cost sharing and coverages existed. Pierre Trudeau and his cabinet colleagues in Ottawa aimed at quickly strengthening the healthcare program, but opposition was strong. The spark plug that fired all into action was Monique Desjardins, then Minister of National Health and Welfare. She famously told Trudeau, "The people want it," and he stood by her as she and her experts dramatically recast the nation's approach to Medicare in the Canada Health Act of 1983. The path of universal health care in Canada has been rough at times, particularly in the realm of federal-provincial cost sharing and in wait times. But so entrenched and so revered is Medicare today that Canadians value it as fundamental to our national identity. Find out more by going to www.civilization.ca/Medicare, where more than 300 web pages and many archival photographs bring to life this facet of Canada's history.
So as you can see, healthcare really is universal in Canada, dating back to Tommy Douglas and his vision of having universal healthcare that is fundamentally affordable and available to all Canadians. So when we look at the Canada Health Act, which is really the governing act or the governing legislation that gives credence to the universality of healthcare in Canada. Well, if the provinces and territories fulfill the Canada Health Act, there are 5 criteria and 2 conditions that need to be ascertained or need to be achieved by the provinces in order for them to get funding through the mechanisms of actions in Canada. That is that the health administration needs to be done through a public administration organization. It needs to be comprehensive. There needs to be a universality of it. It needs to be portable. No matter where in Canada you live, you need to have and should be having access to healthcare, no matter where you live in any province or territory within Canada. Healthcare needs to be accessible. There needs to be a recognition of the organization and what they deliver in their health services, and the information has to be prevalent and up to date for that health service or that organization to be funded by the Canada Health Act. There are a few other things to ensure that there's no extra billing and user charges for insured health services. And once all of these criteria and conditions are achieved, provinces and the participation in distributing and providing health services will receive the full payment from the federal government to fund the healthcare in those provinces. So when we look at healthcare finance and expenditures, well, our healthcare in Canada is financed primarily through taxation, both provincial and federal, and personal and corporate income taxes. Our federal funding is transferred to the provinces as a combination of both cash contribution and tax points. Public sector funding represents 72% of total health expenditures, and the remaining 28% is financed privately through supplementary insurance, employer-sponsored benefits, or directly out of pocket. And most public health care funding comes from a central revenue stream. Some provinces have ancillary funding methods, which are normally targeted for healthcare, such as sales taxes, payroll levies, or lottery proceeds. When we look at the federal role and what the federal government plays in our healthcare, well, they assist in financing provincial and territorial healthcare services through those fiscal transfers that we've just previously talked about. They set standards and principles upon which transfers are contingent upon and deliver healthcare services to specific groups, such as our Aboriginal people and those people in our armed services. And they provide and fund healthcare that are of a related functionality to our healthcare services already established. When we look at the provincial or territorial role, well, they administer the health insurance plan. So each province administers their own health care insurance or their own health policies and their own health services plans. The planning and funding of the hospitals in those provinces and other health facilities. Services provided by physicians and other health professionals, and the planning and implementation of health promotions and public health initiatives. They also negotiate the schedules of what will be paid for our pharmaceuticals that our Canadians use in the treatment and facilitation of their health and well-being. And they do that with not only our pharmaceutical stakeholders, but also with our health professionals. So how much does Canada spend on healthcare? Well, in 2018, 15.4% being considered were out-of-pocket costs. 64.2% was government covered expenditures. 4.8% came from other public sources. 12.4% was funding that came from private insurance plans, and 3.2% came and was rated as other contributions. So in 2016 and 2010, we can see that the public-private split was 70-30 as compared to 2018, where the public-private split was 69-31. So it's maintained the stability over time with a slight variation. So when we look at the future of Canadian healthcare, well, what can we look forward to in the changes that we will experience in our lifetimes as our healthcare evolves? Well, we can look to, and this has been very prevalent over the last 2 years in the COVID situation, of e-health, having more accessibility to virtual visits with our doctors and healthcare professionals, having apps and different other types of opportunities and e-health technologies to help us manage our own personal healthcare. Fewer hospital visits or fewer hospitals being built. That's, it's very costly for our organizations, for our provinces and healthcare establishments to build hospitals. So we know that fewer hospitals are being built currently. However, in saying that, we know that the hospitals that are being built, they are state-of-the-art functional facilities with the ability to have an interactiveness built right in to the technology component, being built right into the hospital infrastructure. We can look at more senior care. Our population is aging, and we know that there is going to be a needed influx of health dollars being focused on our senior care and our private insurance as people return to work and as our population, I want to say, gets more established or reestablished back in the working world. We are going to be looking at private insurance paying a greater portion of our healthcare costs here in Canada. So now we're going to stop our lecture for our class today, and we're going to talk about some questions that really come to mind when we talk about Canada's healthcare services and how we as Canadians will navigate our future healthcare. So the questions I have for our class now to debate on and discuss is, what healthcare issues do Canadians worry about the most? And our secondary question is, do you think that the Canadian healthcare system is better than any other country in the world? So now we'll turn it over to our class to have the discussion on our first topic, what healthcare issues Canadians worry about.